So the Camden Coalition's mission is to actually improve the health and well-being for people with complex health and social needs. And we want to do this, and we try to do this through really transforming the health and social ecosystem that's sort of in our local community, in our regions, and then anywhere we work around the country.
Really, the end game is to improve the health of individuals who live in underserved communities and to have those complex needs so that their lives are better and their well-being is improved.
I think oftentimes when we think about individuals in need, as service providers, as institutions, we do a good job of telling people what they need to do differently in order to get their needs met, right? So you need to fill out this form, you need to be at this appointment at this particular time, you need to make this change. And so we usually do a good job at telling people what they need to do differently in order to get their needs met. But we don't always hold that same mirror up to ourselves as a system, right, as providers, thinking about what we need to do differently in order to meet the needs of individuals. And so in terms of being involved, I think it's important to be involved at both the micro level, right, as we're working with people, but also striving for that same level of transformation at the systems level as a group of providers to think about how we go about our work differently.
And so an example of that is actually work that we're doing with Oaks, where we're in the emergency room trying to figure out how we can better refer people to mental health treatment. And so, we sort of work at both levels. We work with people, but we also work and try to improve systems.
We spend a lot of time talking about social determinants of health at the Camden Coalition because they're really an important adjunct to one's medical condition and influence one's medical condition. Things like transportation, education, access to health care, their knowledge of the healthcare marketplace and their ability to get a physician or get healthcare needs. All of those factors have an impact on one's ability to get care. And so we focus on that. So we look at employment opportunities, we look at access to social services, housing, things of that nature, because it all has an impact on one's health and the ability of an individual to get care.
So we run a program called Housing First, which is a program around the country. It's a program that believes that you actually provide people housing even if they are still trying to get to recovery. So they could be someone who has an active substance use issue, and we try to house them. And we can also work on that substance use issue at the same time, but the substance use issue doesn't get in the way of us housing them. So a social barrier that will get in the way for us is if someone has a lot of fines and fees, maybe things that they picked up loitering, or if they had a parking ticket, or even a jaywalking ticket, if you can imagine. And that when these things don't get paid, something that could have been, $100 in fines could end up being a jail stay. And you can imagine that those things get in the way of recovery. They get in the way of your being housed so that your recovery can actually be supported. And so that's an example of where a social barrier gets in the way of what we consider a health issue.
In our work, right, we can't talk about health, right? We can't talk about well-being without making sure that those type of challenges, right, that folks are undergoing are adequately treated. Right? And so for us, it's always been, how do we play a role in connecting folks to services, and then also how do we play a role in supporting providers in that community. Just like individuals who are experiencing substance use disorder and other mental health challenges, can be overwhelmed by the barriers and challenges that they face, the provider side equally can be overwhelmed, right, frustrated, sometimes with the challenges that they're facing, right? And so I think from our standpoint is, how do we support individuals, right, in a community as they're connecting to services? But in addition to that, how do we support our provider community and making sure that even they're in the right headspace to continue this work?
We started our work in Camden 20 years ago, and it was really a breakfast meeting. Dr. Jeff Brenner started that with clinicians and other colleagues who just really were concerned that patients that they saw were cycling in and out of the emergency room, in and out of the hospital, and not getting any better. And so that work in Camden sort of took root. And we realized that in order to help people in Camden, we often needed to really not just be in Camden, but be in the region.
You know, it's with pride that we go to a national convention every year and see greater numbers of individuals attend our national conference and participate in this emerging field of complex care. Obviously, that reflects on the organization and the organizational leadership, but it bodes well for us as healthcare providers here in the city of Camden, because that's where it all started. And it's amazing to me that this little organization, you know, the little engine that could here in Camden, has now grown to these levels and are influencing healthcare policy nationally.